closer to home, hospitals say they are ready should they be faced with a case of Ebola.
WIAT 42 News reporter Natalie Tejeda talked with one ER doctor who believes that the likelihood of an outbreak here in the U.S. is unlikely. She joins us tonight live in the studio. Natalie.
That's right, Trent and Sherry. From the quality of medical care to access to medical care to the ability to quickly quarantine infectious diseases, there are a lot of reasons the likelihood of an Ebola outbreak here in the U.S. is so small. But if someone exhibiting Ebola-like symptoms did walk into UAB hospital, doctors say they would be ready.
Emergency rooms are always busy, but with Ebola fears on everyone's mind, the ER staff at UAB is ever vigilant.
Our nurses are trained here at UAB that if you arrive and you say you have a fever, the next question they ask is, have you been exposed to somebody with Ebola, or have you been in an area that could have potentially exposed you to Ebola?
Typical Ebola symptoms are fever, body aches, vomiting, diarrhea, and bleeding. But unless you've been to West Africa, you most likely haven't been exposed.
The virus lives, whether it's in blood or emesis for when you throw up, or tears or something like that, where you actually directly contact a body fluid that contains the virus. So just casually touching a doorknob or even sitting next to a person on a plane or on a train or on a bus, those things aren't the typical way that Ebola spread.
Remember, the person who exposed you had to have been actively showing symptoms to be contagious, and it could take up to 21 days for you to show signs. But if you think you have Ebola, doctors say get medical attention immediately at a facility like UAB.
You're immediately isolated and put into an area that would protect yourself and also protect staff and other patients.
Now, for more information about the Ebola virus and our state's preparations, you can log onto our website at WIAT.com. In the studio, Natalie Tejeda, WIAT 42 News, coverage you can count on.